Innovative content, global audience.
The eyes are one of the most important organs of our body. A healthy pair of eyes means a clear vision, which plays a major role in day to day life. Because of its specialized sense organ in the human that is capable of receiving visual images which are related to the brain. All the different parts of your eyes work together to help you see very well. But when a part of the eyes becomes a cloudy and musty, which can be described as cataract, then there is a cause for worry and concern. What is cataract, you may want to ask? A cataract is a cloudy area in the lens of the eye that leads to a disease in vision. Cataracts often develop slowly and can affect one or both of the eyes, which cause your sight to become cloudy and musty. Beside cloudy, dim, or blur vision, there can be other symptoms associated with cataract, which my special guest today on the show, our health, will be talking about. Good morning. My name is Princess Kessy, and this is our health. You know that your health will always come first. I will reaching you live from our SRO TV studio here in London, the world's capital city. And you're welcome to the show. Now, when we talk about eyes, the eyes are very important. And that is why today we have with me on the show no other Dr. Mrs. August Sandra. She is an optometrist. She's going to be telling us about eyes today, cataract. Quite often we see little children even having cataract. What are some of the symptoms, the causes, and the way forward? Good morning, ma'am, and you're welcome.
Good morning. Good morning.
Nice to have you here.
Yeah, same here. I'm happy to be here.
Yes, ma'am. So quickly, let's talk about cataract. What is cataract to a layman right now?
Okay. Cataracts, in a layman's term, just like you said, is the clouding of the lens. Now, there's a part of the eye that is called the crystalline lens. It's like when you have a transparent glass, like a table tennis that is transparent.
Yes.
Imagine a white table tennis that is transparent. Now, if that table tennis becomes cloudy, for example, you put it in a hot boiling water and it begins to lose its transparency. So that table tennis becomes cloudy. Another example I would want to give also, we all know what a mirror is.
Yes.
For instance, if you have your mirror and maybe a mirror in a bathroom and you just finish taking your bath with hot water, you will notice that the mirror becomes cloudy with steam from your hot water.
Yes, that's true.
Yes. Yes. So that's what a cataract looks like. So it's the clouding of the lens. So because of the clouding of that lens, it prevents the vision to be as sharp as it should be. Yes. So it's usually something that happens with age. Most of the time, most cataracts happens with age, especially from 40 years and above. And not because it is a bad thing to get old, but because as we age, there are some proteins inside that crystalline lens I talk about. They begin to dissociate and then they clump together at different sides of the lens now. So with time, the lens becomes not as transparent as it used to be.
Okay.
There are other things, yes. There are other ways too that cataract can come to the eye. It's not only for elderly persons. A young person can have cataracts. Even a newborn child can have cataracts. Now, in cases like that, when we see a younger person with cataracts, it's usually as a result of either trauma or the person was born like that. So probably there was not a full development of that part of the eye while the child was forming in the womb. Then in cases where you have people who are diabetic, uncontrolled diabetes. We
Okay.
tend to see, yes, we tend to see cataracts in younger persons who have uncontrolled diabetes. Yes. So
Wow.
cataract is not just for elderly persons. It can also
Because
happen in a younger person.
I have a nephew that they had to carry out an operation on him on the both eyes. That operation took
Yes.
place 2 years ago, and as at that time he was 5 years thereabouts. And his own was even, we thought it was just something. And at some point, people were saying, they were telling my mom, which is the grandmom, to buy some native things to put and all that. My mother said, no, he's a child. At the end of the day, they took him to a specialist that referred him to Kano, which they had to do a surgery on one of the eyes, and later they had to do a surgery on other of the eyes. So I was surprised that how can a child be having the faced with something like this, and that maybe that is why I'm more interested in this topic today. What are some of the first symptoms of cataract?
Okay. One of the first symptoms you see in cataract is, apart from the cloudiness, most patients will report that things look cloudy. They will always report it like harmattan, like everywhere feels like there's harmattan. Then,
Okay,
secondly, they would always complain of light sensitivity, over light, like they will be oversensitive to bright light. For example, they would not be so comfortable going out under the sun, but they
okay,
will be more comfortable going out at night.
okay,
And yes, and the reason for that is because of those proteins that I talked about. They don't like the appearance of light. They scatter light whenever someone with cataract is under the sun. Those proteins begins to scatter the rays of light that should ordinarily move into the eye without any issue. They begin to scatter those lights, so making the person overly sensitive to light. So that's the second symptom. Cataract is painless. So most people that have cataract would not really complain of pain, except there is another underlying factor that is causing pain. Then
okay,
the third thing, yes, the fourth, there will be a reduction in the visual, what we call the visual acuity, like the way the person perceives things at far and at near will be very reduced depending on the stage of cataract, because there are different stages of cataract. So for someone who has a full-blown cataract, might not be able to see you with that eye that has the full-blown cataract at a distance of, let's say, 2 meters or 1 meter. But for someone with an immature cataract, it might still be able to see you at that distance. So that's why I said depending on the stage of the cataract. So, but basically, it causes a reduction in visual acuity. Like the visual acuity is the way we should see things, the way the brain interprets things that we see. So it reduces the vision, the way the person perceives things, because not the brain is not getting a full information of what it should see.
get.
Yes.
Now, when we talk about
So that's
cataract, go ahead. You wanted to say something. So
okay.
that's basically
Basically that,
the
yes,
first
those
sign.
are the common symptoms. Yes.
Okay. How do we when we talk about cataract, are they different types, or what are the types of the cataracts? You talked about blown full cataract. From here, we could see different type. We could see glaucoma, which is a little bit small, and we see the cataract, which is full blown. What are some of the different ones we have?
Okay. Basically, they are they are not like different types, but they are different stages
Okay,
of
all right,
cataract.
all right.
Yes. For the types is a medical, yes, for the types of cataract, there we have the nuclear cataract, the senile cataract, and all of that, but they are all basically cataracts. But the basic thing is the stages of the cataracts. We have the early cataracts,
Okay.
like let's say um early cataracts. In early cataracts, you don't have all of the lens being cloudy. You just
Cloudy.
have parts. Yes, you just have parts of the lens being cloudy. So someone with an early cataract might not even know that he has cataract or she has cataract. Then we have the middle stage cataracts. So like half or if not almost part of the lens is already filled up with what we
Okay.
call opacities, which is also cataract. Then we have the full blown cataract. So that's the one you see with you look at somebody's eye and you see that it's white. So that
Okay.
is a full blown cataract.
Wow.
Though there are still some yes, there are still some cataracts that can be full blown without you having the whitish thing coming out of the eye. So that is where the types of cataracts come in. So it's either the cataract is happening at the outer part of the lens, the middle, or at the inner part of the lens. So for most persons that have this whitish appearance on their eyes that show that they have full-blown cataract, most times it's usually the outer part of the lens that is affected. So, but for people with the nuclear, what we call the nuclear cataract, you might not know they have cataract by just looking at them. So you have to still go for a proper eye examination before you be able to see that they have cataract.
Wow. How can it
Yes.
be
The
fixed when we
same,
talk cataract?
I didn't get that.
How can it be fixed? How can it be treated? Must you
Okay,
have to
well,
fix
cataract,
surgery, or at the early stage it can be treated without a surgery? Because I know that of my nephew, we had to go through the surgery process for the two eyes.
yes. Well, cataract can be treated. So the treatment of cataract involves removing the lens that has been affected, the cloudy lens, and then replacing it with an artificial lens. Is one of the most successful eye surgeries. Like it's the chances of vision getting better after cataract surgery if there are no other underlying underlying conditions in the eye like glaucoma. The chances of cataract surgery being successful is most times, let me not say 100%, but 99%. So it's a very successful surgery. So, but most times, because of the types of cataract surgery that are available, most times your doctor would always want you to wait until the cataract is matured
Okay. So you're able to.
before the surgery is done.
Okay.
Yes, well, not really, not that it cannot be removed when it is not matured, but we believe that you still have a level of vision left. So why do surgery on the eye that can see? So,
But
but
what
notwithstanding,
if you don't remove it at that early stage? It's still going to grow big, right? Regardless.
not really. Now,
Okay.
for cataracts, especially for elderly persons, there
Okay.
might be a chance of a reoccurrence, but it's not so immediate. It might take time, 10 years, 20 years before there will be a reoccurrence, especially as the person ages.
Okay.
Because what was put in there, don't forget that it is artificial. So it cannot be as perfect as the one that God has put in our eyes. So there is a chance of reoccurrence of cataract after 10 or let's say 10 years, 20 years, depending on the type of lens that was put in the eye during the surgery. Yes. So I was trying
Okay.
to say that
Go ahead.
the surgery the surgery can also be done at the early stage.
Okay.
So it is not only at late stage that surgery is done, but it depends on the individual. For example, if you have a young person who is a working class person, he needs his eyes for his work, and then he has early stage cataract and is already affecting his normal day to day activities, cataract surgery can still be done on that eye. But if you have a very elderly person of about 60 years and he's not working, is retired, just maybe just doing one or two menial works and doesn't really has need for what I would call a functional vision, the cataract will advise most times that such a person waits until it is matured. So it's not only in the early and the late stage that the surgery can be done. There are procedures like the laser cataract surgery that can be done at the very early stage. Yes.
Wow. And now, before we even move forward into, how it can be treated and if left untreated, what are some of the major causes? You did talk about diabetes. You did talk about because that of my kid brother was a child, and I think they had to notice while he was quite little, but the doctor said they can't carry out an operation. We should still leave him for some time. And now, but we noticed that the grandmother from the maternal side has it, and the grandfather as well has it. So, what are some of the causes?
Okay. Age number one, like I said, one of the causes. Then trauma, like when you have a hit on the eye, can lead to cataract. Or yes. Then exposure to some kind of radiations, very strong radiations, can cause cataracts. Yes.
Okay.
Then, like I said before, also uncontrolled diabetes can lead to cataracts also. So those are the four major causes of cataracts. So, but the major one is the age factor. So that is why you will see cataracts more in elderly people than younger persons.
But how do we describe children having it then?
Well, it depends. If the child had a trauma, maybe someone hit him on the eye, or there's a slap to the eye, and there's trauma basically can cause it in children who didn't have it at birth.
Okay.
Or children who have diabetes. There are children who have diabetes, they can also have cataracts. Okay, so but for children who have it at birth, it is a birth defect. It's something that happened while they were growing in the womb. There are some structures that were not properly developed in the eye. So that is where you have it in children congenitally, yes.
So it means that it's not genetic. It's not something that because my parents have it, that means I'll have it.
No, it's not genetical.
Wow.
It's not genetical.
So, well, viewers, this is Our Health, where we talk about your health. You know where you are. Your health will always come first. And today is about our eyes. Of course, the eye is, you ask me, is the most important part of our body as a whole. Because if you can't see, what becomes of that person? Now we'll go on a quick break. Don't go anywhere. We'll be right back after the break.
Hooray! The next President Show is here again. Are you aged between 18 and 30, smart, bold, and possess exceptional leadership skills? Do you have what it takes to be the next youth governor and future youth president? Then register free now at superiorradioandtelevision.com or call the number on the screen. The Next President reality TV show, moving politics out of the polite drawing room into the clamor of the streets. Are you a filmmaker in Abuja and its environ? Do you need a place for your music video, or you need a venue for your conference and even an editing suite for your post-production? Look no further. Our beautiful turret in Lokugoma has it all. We have a whole floor that consists of 3-angle lounge, a beautiful dining area, a large kitchen, a conference area that can comfortably accommodate 60 persons, and 5-bedroom adaptable for all kind of shoots. The good news is all is available at affordable price. And you know what? If you are a member of the Association of Movie Producers of Nigeria, you have 20% discount. So What are you waiting for? Hurry and contact us on the numbers on your screen now.
Hello viewers, you're welcome back from that quick break. This is our health, and today's topic is quite an interesting topic. We'll talk about your eye health. What is cataract, the symptoms, and of course the causes as well, the treatment as well. Welcome. I'm still here with Dr. Sandra. Doctor, can you sit up a little so we get to see you very well?
Okay, sorry, I just had a little cut in my phone.
Sorry.
Can you hear me?
Yes, but you have to sit and put your phone properly so we can see you very well.
Okay.
So it's turned
I guess
at the
that's
other side. You need to rotate it, turn it round.
Sorry, just give me a
Turn it
minute.
round. We can see you very well, Dr. Sandra.
Much better.
No, not at all. Just turn it round. The way it was before, the way it is now is as if it's like that. So just position it somewhere that we can see your face. No, you've turned it again. No, leave it straight. You can see the screen, right?
Okay.
Like
I
that.
can't.
Okay.
Is it okay now?
Yes, it's perfect.
All right.
Now, what happens if cataract is left untreated?
Like I said before, it's not a painful condition, but if it is left untreated, it's over time it can block what we call the drainage inside the eye, and it can lead to glaucoma if the cataract is not removed on time. So, but on its own, it cannot really cause any serious issue apart from the discomfort it gives to the individual. But if left untreated for a long time, it can begin to release some particles that can block the normal drainage inside the eye and over time lead to glaucoma.
But if not treated, does it mean that over the years, as the person gets older, they can still see? It's just that blur vision they have, but they cannot go blind. Is it what you're saying? Hello, Dr. Sandra. Can you hear us? Okay, I think we'll have a little bit of network issues there. I am quite concerned. I really want to know about this. It's as if when you have somebody that is affected with this topic, you want to just strive to know more. Because I know my younger brother, he couldn't see. At that point, he can't see. The younger one, we have to start holding him around. And it was quite worrisome. Even after the surgery, he actually came to my house in Abuja before they went to Kano. And when he came back, since then, he has been using glasses. And so we were worried because at that early stage of it, and the doctor said they won't be able to do the surgery because he was quite younger. But when he was around 4 years, they referred him to Kano for the surgery. And at that point, he couldn't see, like practically somebody will have to hold him around. And even if maybe apparently when light even goes off at night, he starts screaming, "Mommy, mommy," and the younger ones are there. So this is something I think everybody should take note of. I wanted to ask Dr. Sandra, she's connecting back with us now. I wanted to ask her, how is it that if left untreated, will lead to blindness and the dangers if left untreated? Though she said it's just the discomfort, we have to say she's still having network issues. That is the discomfort, but I think I bet to I want to know more, because if it's just the discomfort, I don't think my younger one would be needing somebody to take him around, even the house that he's used to. And now this is what I wanted to know: if truly is something that can lead to blindness, definitely, or you just have to live with a blurred vision all your life. Dr. Sandra, you are having connect to a stronger network because we need you to really talk to us about what cataract is and if it can lead to blindness. Although the doctor said it's a painless surgery, but I don't want to go what my younger ones, maybe because it's a child, but that was terrifying. And so if there's a way we can prevent, I was about coming to the preventive measure, if there is any. She did talk about, radiation to the eye, excessive heat to the eyes, and that is why it's good as well as a human being. If you're somewhere and maybe you're close, you're always using the gas or fire, I think you should be able to, know from now on that it's something that is quite dangerous to your eyes. We all know that fire, heat is not so good for the eyes. No wonder this period here in UK, if I'm cold, I stay very close to the heater. I start feeling this hotness in my eyes, and I thank God I actually brought up this topic today. It's actually for my good as well. Dr. Sandra, welcome back.
Thank you. Sorry for that.
No problem. And so I was going to ask you, you did say it's just the discomfort the patient will have to live with, or the person will have to live with for their lives. But like my younger one, at that point, he couldn't see. It was getting serious that he can't see. The younger one would practically be holding him around. Does that mean that it cannot lead to blindness at some stage if left untreated?
Well, it does not directly lead to blindness, but it indirectly leads to blindness. Like I was
How
saying
is
before,
that?
the network issue.
Okay.
Okay.
All right, go ahead.
Now, when a cataract is matured, it begins to release little of its particles into what we call the an outflow in the eye. We call it the drainage system of the eye. Now,
Okay.
over time, the more particles that are being released, the more the drainage is being blocked. So with time, there's a pressure buildup, and then the nerves at the back of the eye become affected, which leads to glaucoma.
Okay.
So that is how it can lead to blindness. So it's not like anybody who has cataracts will be blind. But
Okay.
if left untreated for a long period of time, it can lead to glaucoma, which leads to blindness. So it is not the cataract that leads to blindness, but the glaucoma, which is caused by the cataract, that leads to blindness.
Okay, so I want to believe that when we talk about this glaucoma, sometimes you see people having it, it's on this eye, and the next time you see it developing on the other eye. Why is this?
Okay, are you talking about cataract or glaucoma now?
Cataracts.
Okay. Well, yes, like we said before, it's age related. So if most times it starts on both eyes, just that one eye might be more severe than the other. Okay. So, but for people with diabetes, it starts on both eyes at the same time. Sometimes they have matured cataracts on both eyes at the same time. So it's not common when cataract is caused by age, but it's common with people who are diabetic. It means something from the body system is the one causing the cataract. So, but it is natural for one eye to have cataract and the other eye to have cataract because they are both part of the body and they are all aging at the same time. But most times, both eyes start at the same time, just that one eye will be more than the other. So that's why it might be that after doing cataract surgery on one eye, the eye which you felt was clearer begins to look cloudy. Then you might have to do surgery on the other eye over time.
Now, what's the possibility that when you do this surgery, now if you're having cataract or glaucoma, you do this surgery and you can see, what's the possibility that you're not going to be faced with these cataracts in the future?
Well, your lifestyle should be controlled. If it is someone
Okay.
who has diabetes, your diabetes should be well controlled. If it is someone who is always been exposed to radiations, you have to keep away from that. Then protective lenses could be given to you to also help your vision to be brighter, because after cataract surgery, there's always, most times, there's a refractive error that comes with cataract surgery. Then basically, we will always advise that one eats very well, fruits, vegetables, take a lot of water and all that. But like I said earlier, cataract can reoccur 10 or 20 years after the surgery, depending on the type of artificial lens that was in place, that was implanted during the surgery. So it's bound to reoccur. But if one can control his general lifestyle, it slows down the progression.
Wow. Now, so it's safe to say that the primary cause of glaucoma is cataract when you have cataract.
Not really. That's not the primary cause, but it's a secondary cause
Secondary cause.
of glaucoma. Yes.
Wow. And now, how can this be, avoided totally? How do we care for the eyes? I know you did say people should stay off your lifestyle. Apart from these, now we're talking about our eye health generally. How can we, at what point, is there anything like a routine? Can you go? Is there anything in your field where people can go check the eyes once in a while? Or how do you ascertain? How can you care for the eyes?
Of course, we always advise that when one gets to the age of 40, at least you should have a routine and a dilated eye exam once a year. Not
Okay.
only for people 40 years and above, but most especially for people 40 years and above, because that's when all of these eye conditions begin to manifest, like cataract, glaucoma, and the rest. So they begin to manifest most times around that age. So we always advise people from the age of 40, especially, to make sure that they have a fully dilated examination at least once a year with a qualified doctor, and not just getting glasses, because you see that a lot of people, they believe that once they wear their glasses and they are seeing clearly, their eyes are perfect, but it doesn't work like that all the time.
People
There are
like
some
us,
eye
right?
conditions. I wouldn't say that, because I believe you will be seeing a specialist.
Funny enough, the
So,
last
but
time I went and to renew my glasses, I've never gone back. I think that should be like last year. I can't remember, but it's over a year now. I'll try anyway. Go ahead. Yes, go ahead, doctor.
please do. So, like I was saying, okay, there are some eye conditions that do not manifest immediately, and the person would be
Okay.
seeing clearly with his glasses, he will see very well, and then all of a sudden the vision is gone like that. So that is why it is important that you do a fully dilated and comprehensive eye test with either your optometrist or your ophthalmologist at least once in a year, at least. So if you can do once in 3 months, fine. Once in 6 months, fine. But at least once in a year.
Okay.
Yes.
But doctor, if we talk about eye health, what are some of the food you recommend, or is there nothing you can eat anything apart from diabetic patient? Now you said lifestyle. So when you say lifestyle, can you go a little bit, give us details? Is there some of the things we should avoid being an optometrist? Things that are not good for our eyes. There's this
Yeah.
school of thought. There's this school of thought that says that onions is very good for the eyes. So you see people eating so much onions. You see people cutting onions, so much of it, eating raw, that it will clear my eyes. Now, how correct is this? And what are some of the things we can actually eat to benefit our eyes, regardless we still see a doctor, but how do we even start at home?
Okay. For that of the onions, well, onions, yes, onions is good for the eye, but it doesn't mean that it can cure an eye condition. Like when
Okay.
you cut onion, your eye tends to tear and all that. Some persons believe that it's washing the eye. Well, it's washing the eye indirectly, but onions contain some things that are like antioxidants that helps the eye, just like your carrots, your vegetables,
Okay.
your fruits generally. Yes. So for back to the question of what one can eat, lifestyle and all that, yes, basically fruits, especially colored fruits. In fact, all
Okay.
fruits are good for the eye because they have their own different vitamins and antioxidants that help the eye. Then when it comes to lifestyle, smoking, smoking is one
Okay.
of the things that can make
Smoking
one to
is
have,
dangerous.
yes, alcohol and smoking because they always come together. They are
Okay.
brothers and sisters.
And
Yes,
that
so
is
alcohol, smoking, those two things can make one to develop cataract faster than they are not supposed to.
okay.
So yes, then I talked about radiations, people that work in maybe companies that they release some kind of radiations. Those people should avoid those radiations by getting like a work goggle. There's what we call a work goggle that should
Okay.
reduce, yes, like the welders, for example,
Okay.
the welders, that light that comes from when they are welding, it's over time it can lead to cataract. So yeah, so you see most of them at old age having cataract, apart from the fact that the particle from the welding something can get to their eye and cause some issues. But because of over exposure to that radiation, over time they are more prone to developing cataract. So we always advise that they use work protective goggles, like the very, very dark. There's what we call a UV blocking goggle, not just the regular black sunshade, but something that would block that light from the radiations from the light from getting to the eyes and causing cataracts in future. So those are the basic um, things. So,
Preventive
but
measures you
in
can
all
do.
of, yes, yes, yes.
Now, when we talk about the cataract itself, at what point should a patient see or someone see a doctor?
Well,
I didn't know
I
that you
would say
said
at
we should be going for that checkup once in a year. But Nigerians now, Nigerians are stubborn. They don't like seeing the doctor. Of course, just or maybe just because there
until
is
it gets bad.
or emergency. But I am surprised when people say they don't see a dentist to wash their mouth or have a mouth wash. It's just the same thing. But at what point somebody having it, you notice that at what point should you start worrying to know that okay, this calls for a professional doctor and not just a doctor.
Okay. Now, at the point where you need to, for people who do not, now I'm talking about people who do not go for regular eye checks. Um, whenever you notice that your vision is not as clear as it used to be, I always advise my patients that once in a while just close the other eye. So that's a way of you doing like a test. And I think WHO brought out there's an app where you can do a sort of visual screening for yourself just to check if your two eyes are working in accordance with each other. You can
Okay.
do that for yourself. Then if you notice that you did not pass that test, then please see a doctor. It is even stated on the app. Then also, if you begin to notice that you see halos around lights, like you look at a bulb and it looks like there are a lot of lights on just one bulb, please
Okay.
see your doctor. Yes. Then if you notice that your glasses, the way your reading glasses is getting weaker earlier than it should. Usually, your glasses for people that use reading glasses, it should be within a period of 1 year, 6 months to 2 years. So, but if you notice that you have to change your glasses within a year of getting another one, then you need to see your doctor. That is, if your glasses was not gotten from a doctor, then If you notice that at night you see better at night than during the day, then you
Okay.
should see your doctor. Yes. So basically, when your vision begins to get cloudy, or you don't have to wait till that time anyway, but if you notice any change in your vision, please try to see your doctor.
Wow. And now, when we talk about cataracts and the eye, how dangerous is it when young girls put, fix, the eye is a very sensitive part of the body. How dangerous it is when people start to fix contact lenses on their eyes.
Well, contact lenses are medical devices. Yes, we use them in the clinic.
Okay.
Now, the only time it poses a risk is when it is not done by a professional, like the one you see them do. Yes. So that's when it poses a risk to the eye.
So that means the one that is being done and the salons and not poses a threat as well.
Yes, because there are some rules you follow before you use a contact lens. There are
Okay.
things your doctors will check before you are being asked to use a contact lens. So it's not just all about the aesthetic part of putting it and then looking beautiful. Contact lenses can serve as your glasses too. So when it is not being recommended by a professional and you are not being taught the things to do while you are putting on contact lenses, it can pose a risk to the eye. It can even lead to blindness, functional blindness. Yes.
Okay. And but can someone use contact lenses and still use the glasses like this at the same time?
On top of it, well, it
Yes.
depends. If your contact lenses was made to replace your glasses, when you are putting on your contact lenses, you don't need to put on your glasses. So, but if you are just using a plain contact lens without any prescription, you can still use your glasses on top of the contact lenses.
But the contact lenses you talked about, does it mean that they are not removable, or is something that the patient will have to be removing and fixing at one point in time, or all the time they need to fix, they will have to see a professional? Because I have a lecturer way back in school that used to use that has is for no reading and all that.
Okay. There are different types of contact lenses. There's the one you can wear for 30 days stretch without removing. We call it the extended wear. There's the
Okay.
one that is called the daily wear, the one you wear every day, you remove, you must remove. That's the daily wear. So it depends on the one the person is getting. If it's an extended wear, you can sleep with it on. You can you can wear it to, you can wear it for 30 days, for a month without removing. But if it's a daily wear, we don't even advise that you sleep with it on. So those are some of the things that we tell patients when they want to get contact lenses.
Wow. I've learned so much today from you, Dr. Sandra. Thank you so much for being
Pleasure is
on
mine.
today. Yes, but before we let you go, just leave a small word like this for our guests, our viewers, about their eyes. One sentence for them.
Okay, your eye is precious. They know they say eye for markets. There is
I'm
no
done.
eye. There is no eye transplant. Yes, there is no eye transplant, but there's kidney transplant. So please don't lose your eyes. They are very precious.
The eyes indeed are very important, if not number one, organ in the body. Imagine you're not seeing, you don't even know what people are doing around you. That would be the worst thing. I wouldn't pray for anybody.
Of course.
Well, thank you so very much, Dr. Sandra Ogo,
Welcome.
for being on the show today. We appreciate your time. Hope to have you again next time on our show. Thank you so much.
Yeah, anytime. You're welcome. Thank you.
Yes, viewers, I've been on the show with Dr. Sandra Ogo, and she's an optometrist. The eyes, I will always tell people, I don't joke with my eyes. Or if it's that one, before you know, I've gone to see, the optician because I don't want issues. Normally, while growing. I've been using glasses, and the blurriness and all that. Maybe that's another topic I'll pick for another day. But I was more concerned about this because my little brother was involved, and now we have been taught and things we should do and they don't. Of course, your eyes are number one important organ of the body. So please, your eye is precious, like she said. Take good care of your eyes, and they do eye transplants. Whatever you do while you're doing all that. I know you girls doing contact lenses. Please be careful now, right? Whatever you do there, make sure that liquid they use, whatever it is, is preserved, is whatever is safe for your eyes. Before you do that beauty pageant, be sure that your eyes are okay. And that was all we'll be able to take today on our health. Well, your health will always come first. I'll see you again on the show next week. Before we go, don't forget to follow us on our social media handles. Subscribe, invite somebody to the page, follow us on Instagram, follow us on Facebook, follow us on Twitter and X, and follow us on YouTube, which subscribe and leave us with your comments as well. We'd love to hear from you. Don't forget our SRTV packages, travel tours, events coverage, rentals, and our magazine as low as 30K. You can be on our magazine to showcase your brand. And don't forget our outlets as well, where we just come in for your production. You can shoot, you can have your meetings, your conference and all that for as low as this, and then you are there doing your business. So please do reach out to us. We'll love to see you win. And please take good care of your eyes. They're a very important part of your body. And so make sure you take your eye health serious. I'll see you again next week. I remain yours truly, Princess Kessy.
Are you a filmmaker in Abuja and its environ? Do you need a place for your music video, or you need a venue for your conference and even an editing suite for your post-production? Look no further. Our beautiful turret in Lokugoma has it all. We have a whole floor that consists of 3-angle lounge, a beautiful dining area, a large kitchen, a conference area that can comfortably accommodate 60 persons, and 5-bedroom adaptable for all kind of shoots. The good news is all is available at affordable price. And you know what? If you are a member of the Association of Movie Producers of Nigeria, you have 20% discount. So what are you waiting for? Hurry and contact us on the numbers on your screen now.